And the latest on the COVID-19 situation here in Korea after seeing the second highest daily number of new cases in the pandemic so far on Wednesday. We've seen figures come down slightly today, but we've seen the highest number of deaths yet, reaching nearly 500. Shin Ye-eun reports.
South Korea on Thursday reported 395,598 new COVID-19 infections. Though this was a drop of more than 225,000 from the same time last week, the country still takes up a big portion of all the world's COVID-19 cases. In fact, the WHO said South Korea has recorded the highest number of new COVID infections in the world for 3 weeks straight. Also, the country on Thursday saw its highest number of deaths in 24 hours. 470 people died on Thursday, raising the total death toll to 13,902. But experts believe this number could soon double as the deaths occurring now come from cases reported a few weeks ago. Amid the uptick in COVID-19 figures, medical staff are saying that they have been pushed to the limit. While authorities have said the current medical capacity is under control with 30 to 40% of hospital beds still available, many in the field have said that the government's method of evaluating the country's medical capacity shouldn't be based on the number of hospital beds available for COVID-19 patients. This is because authorities have decided to transfer critically ill COVID-19 patients to regular hospital wards after a week has passed. That's why medical staff are saying that the number of patients they're actually required to look after is much higher than the official figures.
We're trying to prevent the situation from worsening, but we're reaching a limit. Our emergency rooms have partially closed countless times. I don't know how we came this far with so many crises.
To relieve the burden on hospitals who are providing monitoring and phone counseling services to some home recovery patients, authorities have decided to narrow the criteria for who's eligible for these services. The country has some 270,000 patients in this group who are seen as high risk and receive 2 daily health checks from medical staff. They're seniors aged 60 and up and the immunocompromised. From Friday, they will need a positive PCR test result rather than a result from a rapid antigen test to be eligible for an automatic placement in the high-risk group. But even if they aren't in this group, they can call their nearby hospitals and ask for a drug prescription if needed. Meanwhile, vaccination reservations for children aged 5 to 11 kicked off on Thursday, and actual inoculations are set to start on the 31st of March. Shin Ye-eun, Arirang News.